talking about men 50 and under and how they can be smart about their health so that they age in a really healthy way. It's got to start with the family history.
Of course.
Right? You got to look at, and you have to kind of keep track of that, right?
So correct. So if we talk about the tools that a physician has, particularly a primary care physician has, you have your history, your physical, your labs, your diagnostics, and history taking. Overwhelmingly, any good medical educator will tell you that history taking is absolutely the most important tool that you have. So really diving down into how you got this way. Do you feel any symptoms that would be typical for the complaint or concern that you may have, or for findings that I find, like elevated blood pressure, let's say, do you have cardiovascular symptoms or other hypertensive type symptoms? That's always very important. So yes, history is essential. History is also diverse. There's social history, family history, medication history, hospitalization history. A patient in this age range may have had a very benign, I had my appendix taken out a few years ago, and that may be no big deal, but that's important to document. I had my gallbladder taken out. Again, that may be no big deal, but that's important to document. So setting up your healthcare future is probably one of the goals, and history is one of the most essential parts of that.